Are you looking for relevant healthcare information? Log on to Medicircle and watch experienced medical professionals talking on common healthcare topics. Stay informed, stay healthy, stay tuned to Medicircle.
We at Medicircle are constantly working on bringing to our audience all the trending health related topics. It is our primary objective to bring to your attention news and views you need to be aware of to lead a healthy, disease free life. To help us in this regard, we'll be joined by eminent and expert top doctors from across the country. Today in Dr. Speak, we are going to talk about problem of AIDS and ways to help you deal with it. Hello, this is Aprajita Mehra and you're watching Medicircle. Today on our AIDS awareness series, we have Dr. Kalpana Somji with us. Dr. Kalpana Somji is a HIV consultant in Mumbai and having over 20 years of experience in this field. She has completed her MBBS from Grand Medical College in 1982 and postgraduate diploma in HIV medicine at BJ Medical College, Ahmedabad. She has been practicing at Shanti Avedana at Bandra.
And for our audience benefit, my first question to you in this interview would be, ma'am, what is AIDS?
Yeah, AIDS is actually acquired immune deficiency syndrome. So as the name suggests, it's acquired, means it's coming from outside the body and then it enters the body. Immune deficiency because it decreases the immunity power of the body. So it is immune deficiency. And syndrome because there are more than two diseases existing in the body, two or more diseases coexisting actually in the body. So it's a syndrome. So this is acquired immune deficiency syndrome, and this is caused by the HIV virus. So when the HIV virus enters the body, we call that person HIV infected or HIV positive. So the HIV positive person only has the AIDS. So when this HIV virus enters the body and the patient becomes HIV infected or HIV positive, the immune system lowers. And then like there are many infections which come inside the body coexisting with each other, and the disease advances and we call that person has got AIDS. So normally what happens when the HIV virus enters the body, it kills white blood cells, which are our immunity. So in these white blood cells, there are T lymphocytes. So these T lymphocytes, particularly there are CD4 cells. So in normal person, CD4 cells are from 500 to 1500. But when the HIV virus enters anybody's body, so it starts killing these cells, which are very important for our immunity. So when there is a decrease in the number of these CD4 cells, like our immunity decreases, and then like the person gets this opportunistic infection, very serious opportunistic infection, when there is a CD4 count is too low. And then that person develops two or more diseases inside the body. And then we call that this person has got HIV AIDS. But then like if these people are not taking treatment, then only they advance towards AIDS. Suppose this person is HIV infected and test for CD4 cells and how much virus is inside the body, that we call a viral load, HIV viral load. So if a person is immediately put on treatment, because there are now a lot of drugs are available for HIV treatment. So once he is put on treatment, his CD4 cells increases, that means his immunity increases, his virus is getting killed. So the number of virus in the body also goes down, and the person is free of all these opportunistic infections, and he lives normal life as any other person, like who is HIV negative. So you can't even make out that this person is HIV infected because he doesn't have all those diseases or he has not developed AIDS. This AIDS person, you can see that he's very sick. So like he has got something, like people can make out. But if the HIV infected person takes the treatment in time, he can live normal, healthy life, and he can be free of all these opportunistic infections.
Right, ma'am. So how can AIDS be transmitted? We need to reinforce this, how it is transmitted to our youngsters who are not very much aware of it.
Yes, but AIDS will be developed in the person who is HIV infected. So we have to see which are the ways where the HIV virus enters our body. So there are mainly four ways. So one is unprotected sex to the with the partner. Like we don't know much about that partner's past sexual history. So in this case, what happens, like if the person, that partner is HIV infected, and then if this person, this healthy individual has a unprotected sex with this HIV infected person, then this virus from that infected person is transmitted to this healthy person. So very important is that they should not have unprotected sex with unknown people, like whose sexual history you don't know, like because they may be having multiple partners, their multiple partners may be having multiple partners, and there are people who are unaware of their HIV status. They may be HIV negative, they may be HIV positive. So these people, so if person is HIV negative and this person has, maybe this time he will be safe. But then suppose if he comes in contact with HIV infected person, and if he has this unprotected sex, then he might acquire this thing. So it can be vaginal also or anal also. But the anal is more dangerous than vaginal, this thing. Because in anus, what happens, and sometimes there is a tear, and the anal mucosa is very thin and very delicate. So if the person is receptive in this sex, then he will get infection more, because his anal mucosa is very delicate, and there may be bleeding, there will be cut. So any injury to the anal mucosa will make this person for the acquisition of the virus from that other person who is insertive. Okay. So this is very important. In vaginal, this thing also, the receptive person is more at danger than the insertive person, because vagina also there is a lot of fluid is there, vaginal fluid is there, or there may be a vaginal mucosa is also, if there is a tear, if there's a breach, or if there is a breach in the skin of the vulva, vagina. So this also, like, it makes that person who is receptive the vulnerable for acquisition of this HIV virus because of those cuts and the fluid and all.
Right. All right. So, these are two.
This is this is one is unprotected sex. Correct. It can be anal or it can be vaginal or this. So this is for. Second one is if the individual receives infected blood through the through blood transfusion, then that person can get, because the blood of the infected person is directly pushed inside his body. So there are very high chances of getting HIV if this blood transfusion which is getting is HIV infected blood. Okay. But like in the beginning, like in 90s and all, like these blood banks and all, when that time this testing was not so much in practice. But now, like, getting HIV through infected blood is very rare.
Yes.
Very rare, because this blood is already tested and then pushed. But then sometimes when you are collecting the blood and the person is in the window period, like, the day this virus entered his body until the antibodies are developed. So that period is very dangerous, because that time that person who is donating blood might test HIV negative, but he has got a virus inside the body. That is why it is not completely eradicated through this blood, because there are chances that if this person is in the window period and he has donated the blood, but that window period also now has been reduced because of the latest blood test that we can detect it within 1 week. But then first 1 week, again, it is not safe. Right. So within 1 week, like now, previously, like we used to get this test positive after 21 days. Then it began, another technique developed, so it was 15 days. Now this is 8 days. So still we don't have any test that the person is infected, and within 1 or 2 days or 2-3 days we can detect that he is positive. So in that period, if the person gives blood, then this is HIV infected blood somebody is getting. So like this, but the chances through blood transfusion are very less now, because of the testing is done prior to the this thing, because they are testing for HIV, hepatitis B, syphilis, all these blood transmitted diseases they are testing before giving the blood.
Yes, yes.
So this was second.
Second.
Yeah, the third one is like if they are sharing this infected needles and syringes of the HIV infected person. Like this normally mainly happens in IDUs, that is injecting drug users, because these injecting drug users, they are sharing the needles and the syringes with among themselves. That if suppose new people join in their group, then they are again sharing. So they may be negative, but then from these people they get. So there are very high chances of getting this through the infected needles and syringes. So that is also a lot of work is done, like needles and syringes are provided to them, or it's become easily available, and a lot of counseling and lot of IC material has been distributed to them, so that they come to know, like if they do these things, like they will get these diseases. So now everybody is careful about their own health. So they are also like thinking of all these things, and a lot of awareness has been done for last so many years for this. So I think we are this thing that also we are reducing now. And fourth one is mother to child transmission. So if the mother is infected with HIV and she is not put on treatment, then she can transmit the virus to the baby during pregnancy, then during delivery, and even after delivery through breastfeeding. So these are the three ways like where the child can get infected. But this also has been reduced to a very negligible, you can say now, because now last so many years, like we are not even finding HIV, because during ANC, like the checkup is compulsory, like everybody is tested for HIV.
Yes, absolutely.
So,
and it is compulsory for all, mothers who have conceived to go through this AIDS test before they, go ahead with their pregnancy. So this has actually reduced this problem to a lot.
It's a very successful program actually.
Yes, absolutely.
And we are glad that children are now born HIV negative. So like if the mother is put on treatment, then what we are doing, we are killing her virus inside the body. So like if the virus is so less that it's not transmitted from mother to child. So now our children are born HIV free. So it's a really good thing, we are very happy for that.
Absolutely. And after, actually spending exclusively in the field of HIV/AIDS for 15 years, ma'am, I'm sure you must be so happy to and relieved to find this back.
Yes, definitely.
So,
and this goal we have reached recently only.
Yes. So congratulations on that. And we move on to my next question, which is, ma'am, where can one get tested if at all they have this doubt that they might be HIV positive? In that condition, where to go and how to get this done?
Any lab nearby in their local or far away, and it doesn't need a very hi-fi lab or very sophisticated lab, because HIV test is very simple and they can get the report within few hours. So like this is available everywhere in all private labs, in government. Government has specially this ICTC centers, so there also they can get tested. So it is free for them. So everywhere, they can get tested for this HIV, and they will come to know the results within very short period.
Yes, and the fact that it is kept confidential for each patient, that is also a boon. If at all you do not want to disclose it to anyone before you ensure that you do not have it, then it is also very easily available at all government centers, which are free of cost. So you can get them, get yourself tested there. So, ma'am,
and the counseling also done before the testing. It's not that you come and test it, like that. First, that the counseling is done, with this thing. Preparedness is there, and somebody says that I don't want to get tested, because this happens mostly in case of discordant couples, like husband is positive and we want to know the status, but everyone has got a right to refuse the test, that is why the pre-test counseling is done. We explain what it is, why it is important to do it, how it is helpful for you, for your children, for your future, And if you come to know the status of your test as early as possible, we can save you, we can put you on the treatment, and you will be leading the normal life as any other person who is HIV negative. So these all things are like explained in the pre-test counseling, and the consent is taken. That is more important. Consent is taken that he or she is ready to undergo the test. So that's how
I'm sure any responsible, human being, any responsible citizen, once they know and they've been counseled enough about this, they will, of course, want to ensure not alone their own longevity, but also the safety of their own spouses, their kids. Naturally, they would go ahead with it, and it has become so easy now.
Yeah, and mostly this young generation, like who are involved in the high risk behavior, so they are very anxious, immediately from the same day or the next day, they will call us and ask like whether I will get HIV, I have done this and that. And then that time we do a lot of counseling for them. And even after doing the test, they are negative. Then also few months they keep on calling me and they ask me like, ma'am, is it really sure that I am negative? And then so much we have to do counseling for them because they are very scared, and they want to know whether after this, like the test will not come positive. So that is why we are telling them to do the advanced test where the HIV virus, a P24 antigen, or all these tests we are telling them, because the antibody test, what happens, even if comes negative, the antibody can develop till 6 months. So then for them, like they are already very anxious. So we want to do the test which is 100% sure that they are negative, because antibody test in the beginning it will come negative. Then like some people they develop the antibodies even up to 6 months from the exposure, from the day one. So we, in that case also, if they are insisting that we want to do antibody, then we explain to them this, like now you are negative, but you may develop antibodies in your body and the test may come negative positive after this.
All right. So now that the youngsters are actually indulging in such acts, and if they are anxious and they want to know more about it, we would we would lead them to the last question of this interview, and that is, how can AIDS infection be prevented? It is always known that prevention is better than the cure, and it is better to not indulge in things where you get such kind of, serious disease. So, doctor, please go ahead and explain this.
Yeah, AIDS can be prevented. HIV infection can be prevented, because if you prevent HIV infection, then only you are going to prevent the AIDS. So first of all, to prevent the HIV infection, you have to know which are the ways that the HIV virus enters our body, which we have already discussed. The first thing, not to have any unprotected sex with unknown person whose past sexual history we don't know. So that one thing. Secondly, we should not like that will not be in their hand, like not to take the infected blood transfusion, because they are given that. So testing the blood before blood transfusion is utmost important, which is normally done. And thirdly, like people should not share this needles and syringes of the infected person. Means infected women, they should not share with anyone, because they don't know the status of the other person. So you should never share the needle and syringes, because now see how we are doing in the practice. Because previously, like olden days, how we were doing, we were giving injection that day, but now it's come all disposable. You give it to one person and throw it. So now the chances of getting through syringes and needles, like that is also become very negligible. It's minimal now. So that is one thing. Secondly, we discussed about the infected needle syringes, then blood transfusion. Now fourth is mother to child. So the mother, when she comes to know she is pregnant, she has to register her name in some hospital, institution, or with any doctor. Then there they will do the HIV test as early as possible. So if she is found positive, then she has to be put on treatment immediately, so that she will not transmit the virus from her to her baby. So this is very important for the mother, that like to take care of the baby, she has to first take care of herself and not to transmit the virus to the baby.
Thank you so much, Doctor, for giving your valuable time and insights here at Medicircle. On behalf of everyone here at Medicircle, I would like to thank you for joining us today. It was a great, experience meeting you, getting knowledge from you. Thank you so much. It was really a pleasure having you today.
Thank you very much. Nice meeting you too.
Thank you, ma'am.